Good afternoon, everybody, and welcome to today's session in our Go Digital Western Cape webinar series. It's brought to you by the Department of Economic Development and Tourism of the Western Cape Government. My name is Robert Davies. I'm with the Digital Economy Unit at the department, and I'll be your host for this day. For those of you who are in Cape Town, as I am, it's pretty cold and windy today and wet, so it's a warm welcome from a cold Cape Town to our audience who have joined us from the rest of the province outside the metro. It's really good to have all of you here, and we hope that you have a nice warm cup of coffee or tea, and we'll cozy up to the webinar for the next hour or so. So as you know, today we have a very important topic for discussion on this webinar. It is slowing the spread, COVID-19 workplace safety. So this is a very important session, and we hope that you'll find our presentation very informative and valuable to you and relevant to all the work that you're doing out there in the field. So just before I continue, I would like to just share a couple of what we call house rules for the webinar, so that the webinar can run smoothly and that there's no interruptions during the speaking sessions. So if you could just indulge me for 1 second, you should all be able to see your screen. So firstly, I would like to inform you as the audience that this webinar is being recorded. The reason for that is that we make it available afterwards on our digital economy website for people to review once this webinar has been finished, and also for those who missed today's session. Then secondly, also to ensure a smooth running of the session, we please ask all participants, except the presenters of course, to mute their devices and also to turn off their videos. The other important note I would just like to register with you is that the format of the webinar that we have, we do not take questions during the presentations itself, but as audience members and participants, we do encourage you to post any questions that you may have in the chat window, which is on the right of your panel, and we'll have a curated question and answer session once our panelist today has done the presentation, and I'll be moderator for that session. So the last thing I'd like to mention, as you can also see on your screen, for those of you who are active on social media, if you can use the hashtag #GoDigitalWesternCape if you want to share any information about what we are doing here in the series and about this session today. So thank you once again for joining us, for your interest and participating today, and of course for your cooperation so that this series can run smoothly. Then on that note, for those of you who are joining us for the first time, as you know by now, the webinar series is referred to as the Go Digital Western Cape webinar series, and it's a series which has been initiated by the Digital Economy Unit at the department, and it's been running, I think this is our 7th installment. So it is a series which is done in direct support of businesses in the Western Cape, and particularly during this time that we find ourselves in the COVID-19 era. And it's geared specifically at SMEs in the province who are in the non-tech sector, and trying to provide a variety of information, tools, tips, guidelines about how to navigate this difficult time, with a particular emphasis on digitization of businesses and digitization of systems, processes, and other ways that digital tools can be used for business in general, but also specifically during the COVID-19 period. So today our topic is, of course, slightly not particularly focused on the digitization of businesses, but it is nonetheless a very important and very critical aspect which we are all trying to deal with as we're navigating this time. The world of work is severely affected during this crisis, and therefore all sections of society, which includes businesses, employers, employees, government, and other social partners, must each play our role to protect workers, their families, and the public at large. So while more and more businesses across the country and across the world are returning to the workplace. Workplace safety, including how people travel to and from work under COVID-19 lockdown, is a new arena for all. So we'll have to learn to adapt. We'll have to learn to become aware, share more information. And as this process is a new experience for all of us, this is going to be, it's a quite demanding and challenging phase for us to be in. That said, there has also been a tremendous amount of work that has already been done by various social partners, businesses, and government in response to this situation. And that kind of brings us to this webinar today, which really has the purpose of sharing vital information with you, our audience, and the broader Western Cape business ecosystem about regulations, guidelines, and best practices for workplace safety. And it's on that note that I wish to introduce our panelists for today. I'll just share a picture with you. Our panelist today is Helen Davies. She's a Chief Director in the Green Economy Unit at the Department of Economic Development and Tourism. And Helen, while being the Chief Director in the Green Economy team, has also, under this period that we are in now, she has been appointed and is the team lead on the department's Slowing the Spread initiative and workstream. So she really is at the forefront of information, guidelines, best practices, about information about what's happening out in the field, the government's responses, business responses. And Helen has joined us today as a panelist from the department to share with you, as much as we are able to share within a 1-hour webinar, her insights and her views on what's happening in this area that we're all trying to deal with. So Helen, to you as our panelist, a very warm welcome. I know, and all of us know, that you have a lot on your plate. So thank you for being able to put aside the time to join us here today. It's really good to have you with us, and we're looking forward to what you will be able to share with us. So on that note, I'll hand over to you. Thank you, Helen.
Okay. Great. Thank you very much, Robert, and welcome all. What I'm going to take you through is a presentation which outlines what businesses need to be doing in the workplace safety side of things, both in terms of preparing their workplace, managing or preventing infections, and then managing any positive cases. As we go, I'll just bring in examples of what certain best practice businesses are doing, and I'll also focus on certain elements of non-compliance that we're seeing, which highlight and give a sense of where businesses are trying but are sometimes not getting things quite right. Just going to put the presentation right. Okay, so to jump straight into it, first of all, the objectives of workplace safety. So as government, we really acknowledge that to be in the business environment right now is incredibly tough. Businesses have been very hard hit by the pandemic and the response in trying to limit the pandemic. But workplace safety is critical for 3 key reasons. The one is around obviously reducing infection spread. The second is around enabling your business to stay open, because as certain employees test positive or as employees become sick, your business might need to send people home for isolation, self-isolation, and you could rapidly reduce your workforce able to run the business. So your business might have to close and then reopen when people are once again better. But what's absolutely critical as well is the ability for businesses to show that they can manage things responsibly in a COVID environment to enable them to stay open, but also to enable other businesses to open. So the presentation is divided up into 3 key aspects or components. The first is around preparing your workplace. The second is around preventing infections. And the third is around managing workplace infections. The next couple of slides just give a number of tips around each of these. So the first is around workplace readiness. And the first step here for businesses is to develop what's called a workplace plan, which includes a risk assessment. And what's critical here is this isn't a massive document that needs to be done by an occupational health and safety specialist. If you have access to someone with a health and safety specialist, that's fantastic. But for many businesses, this is really just understanding the business and understanding where your points of potential congestion are, whether that be entrances, canteens, your workstations, your aisles in a shop, toilets, your goods receiving areas, etc. Also identifying your high touch areas or equipment or stations. Things like door handles, light switch, lift buttons, etc. Looking at where your key points of interactions are with customers, such as your pay points and customer service areas. Then the next one is looking at identifying employees at risk. So this is defined as people that are over 60 years of age and or who have comorbidities. So those are underlying conditions such as heart disease, diabetes, chronic respiratory disease, and cancer. Then look at those employees that are at risk and look at how you could actually reduce the risk of infection to those employees, whether they are able to work from home or whether you could change the nature of the work so that they can work from home, or if you isolate the area within which they operate in the workplace with very few people, if any, coming into their area of work. And if all else fails, look at placing them on special leave. But time and time again, what the COVID pandemic has shown us is that while the virus certainly can hit anyone, the hardest hit are those who have underlying conditions or are older. You also need to ideally allow anyone who is able to work from home to do so. Sometimes there's a sense of fairness that if certain people need to be in a business, then everyone should be in the business. And it's recognizing that the more you enable people to work at home, you're protecting both those individuals, but also the individuals who do need to come into the workplace because you're exposing them less. A key point is also to look at how you can divide up your teams into smaller teams and look at whether those teams can operate within very defined or isolated areas of the business and how you can minimize interaction between teams. And then lastly on this slide is if you do experience a positive infection or an infection within the workplace is to go back to your workplace plan and your risk assessment and look at if there are potentially any weak spots that need to be tightened and update your plan accordingly. The next slide speaks to the training of employees, and this is training on anything from what the coronavirus is and how it spreads, which many people might think is obvious at the moment or self-explanatory. But I think it is absolutely critical to make sure that all employees are aware. And then helping employees to understand how to prevent infections, both themselves and what the employer is required to do. How to use PPE, their personal protective equipment, what to do if someone's infected or if someone has been in contact with someone who's infected, what they should do when they're traveling to work and in their communities and at home as well as at work. So what you don't want to have is that employees are meeting all protocol requirements in the workplace, but once they're in public transport and at home, they don't wear their masks or whatever it might be. In terms of raising awareness, you need to raise awareness frequently, definitely after you've had positive cases to make sure people understand what's required to minimize infection, and obviously in an appropriate manner. So if your employees don't have daily access to a computer, your means of communication is possibly rather either verbal or through posters and leaflets. Critical is to address employees' anxieties. A lot of people are very fearful. So while the economy is opened, and for many people saw that as a release, could go back to work, for a lot of other people that has brought a lot of fear. So it's acknowledge and deal with those anxieties. And then importantly also is encouraging everyone to be kind. This is particularly where people who have tested positive and who've let out their isolation period have returned to work. We are receiving a lot of reports of intimidation, staff intimidation of people who are returning to work. So really encourage your employees to welcome those people back into the workplace. They're no longer infectious and they're part of your family. And then for all of this, it's really stressing the role of the employer as well as the employee and the customers. And make it easy for your employees and yourselves to enforce what's required on customers. So for example, multiple posters around the workplace really enable employees to point to a poster if a customer isn't wearing their mask correctly or not wearing a mask at all. And then lastly is just communicating regularly to your customers and to your suppliers around what is your workplace protocol, what do you need them to do before they even enter your workplace. An example being customers, you should ideally have posters up saying if you're not feeling right, if you're feeling sick, please rather order online if possible or come back when you're feeling better. So try to stop people from even entering the door if they're not feeling well. In terms of some examples of non-compliance, the first one is around businesses not having a clear or any work plan or risk assessment. And I just want to highlight this is an area of high risk for the Department of Labour, and they have the power to close a business down. So their general ethos is to try and enable a business to stay open and support a business to stay open. But if a business as a starting point doesn't have any kind of workplace plan or risk assessment, it is a red flag for Labour. In terms of non-compliance further is where there's been no infrequent or inappropriate awareness raising. So, for example, a business developing a protocol around preventing and managing infections, but then doesn't share or engage employees on that. And then lastly, employees moving between teams, shifts, branches, and offices. You really want employees to kind of stay in a fairly defined area so that if someone is sick, only a small team needs to go off. So you don't have to have a workplace which needs to shut down because none of your employees can be at work. In terms of actions to prevent the spread of infections, first up is screening. So you're required by law as an employer to screen employees on arrival each day. Just to be clear, screening is not the same as testing. So screening is essentially a questionnaire checking whether the person has symptoms and whether they've been in contact with any positive cases. Ideally, you should be encouraging employees to screen at home so that they don't come into the workplace or even try to enter the workplace if they're sick. And then best practice is using an app to enable employees to self-screen and then also report in the results of that self-screening. You also need to ensure that all employees have masks and sanitizers. Legally, every employer is supposed to provide at least 2 masks to each and every employee. And ideally that they're using those in the workplace for traveling to and from work. Businesses need to enable social distancing, so that's a minimum of 1.5 meters from people. In a bigger room, or any size room, it's a minimum of 6 meters squared per person, and that includes both employees and customers. And then ensuring adequate cleaning, particularly of high-touch surfaces, and good hygiene in the workplace. Where you can't have social screening and or where you have interaction between employees and customers, placing screens in those places is a good idea. In terms of transport, to reduce people's exposure to potential virus on transport is ideally stagger working hours for employees where possible, provide transport for employees to work and back to help reduce their exposure. Where they do need to use public transport is really encourage and keep raising awareness around how to do so safely. And then a flag that's come up for us in a number of businesses is where employees are sharing lifts together and then they don't use masks, etc. in the car. We've sometimes then seen pools of infection. So really encourage employees, if they do share lifts, to still maintain good practice. Have windows open when possible, wear masks, etc. We also encourage businesses to look at spreading out and closely monitoring communal break areas. So we're finding another weak point in businesses, as an example, is canteen areas, smoke break areas where people are hanging out to have lunch. In those areas, generally, masks are often off because people need to eat and drink. But people are congregating in those areas, no social distancing, etc. Also ensure that where your suppliers enter the business, that they follow good practices, and that if your business is delivering to homes, that they do so safely, but that you also upfront require customers to practice safe practices as well. And if you have, for example, contractors working in someone's home, they need to make sure that their customers who are in the home are also wearing masks to protect your employees. If that isn't possible, you need to engage with your clients in terms of whether they can move out for a period or they're not there during the day or whatever other practices are required. In terms of examples around non-compliance and around prevention, we often see no inadequate or incorrect wearing of masks, no social distancing, so too many people in an area or in a potential point of congregation or touching. The communal break area is definitely a weak area. inadequate ventilation of spaces. So this is often storerooms, canteen areas, etc., where you might have points of congregation together with poor ventilation. And where equipment or workstations are shared, no regular cleaning. Inadequate management of workplace safety, where you have your goods receiving areas. Inadequate waste management practices, and then public transport, or people being transported with infected colleagues. Another weak area on this last one we've seen in businesses is when someone who's actually driving employees to and from work is sometimes the infected person and then can infect a number of other employees. In terms of managing workplace infections, there's a lot more detail that goes into this area of work. So this is just a high-level snapshot of key activities required. But first of all, if someone tests positive and they're at work, ensure that they're able to self-isolate. And if they're at home already, make sure they do self-isolate. If they have a challenge in terms of isolating, for example, they live in a house which doesn't have separate rooms and has other family members, you need to help them contact the Department of Health, who will assess the situation and look at whether they provide isolation facilities or quarantine facilities away from away from their place of residence. Employees should also be encouraged to seek medical attention if their symptoms get worse. You as an employer need to help identify and manage the close workplace contacts of that person. A close contact is defined as someone who's been with less than a meter for more than 15 minutes. Those close contacts also need to be sent home for self-isolation if they start showing symptoms, and if they meet the criteria of testing, which is now over 55 and or have comorbidities, then they should be sent for testing. And importantly, you should deep clean the affected area. So to be clear here, because we've had a lot of questions around this, if you have someone who's in an isolated part of the business and they might have used the bathroom facilities or the canteen, the areas you would clean are the areas where they work and those communal areas that they've worked with. If, however, it's someone who's been right through the business, you might need to close the business down to do full cleaning right through the business. You are not required to use a professional cleaning company for cleaning, and you're also not required to have a certificate to show your cleaning. But it is deep cleaning that's required. That can be a bleach and water solution, carefully rubbed down, but you do need to understand where the employee who is sick or who has tested positive has interacted. The next one is if employees display symptoms, and this is, I think most of you are probably aware, in case you're not, there's been a change in the testing policy of the Western Cape and soon to be national. And that is that not everyone is automatically going to be tested if they show symptoms. It's if they show symptoms, they're greater than 55 years old and or they have comorbidities, then they would be sent for testing. But others, if your employee shows symptoms but doesn't meet those criteria, you still need to follow as above. So send them home for isolation, identify their close contacts and managing them appropriately. In terms of timeline for isolation or quarantine, so the person should be in isolation or quarantine 14 days from when tested. Apologies, just to explain the difference between isolation and quarantine. If someone has been tested and they're waiting for their results, or they've been tested and they've got the results that they're positive, or they're a suspected case, so they're sent home but not tested, then their period away from work in their home is called isolation. If they're a close contact that has been sent home for precautionary reasons, they are in quarantine. So for either of these, it's either 14 days from when tested or 14 days from the symptom onset, where they haven't been tested. Severe cases, it's after clinical stability has been achieved, but for a minimum of 14 days. And the close contacts, it's 14 days from when they were last in contact with an infected or sick employee. If someone tests negative, so they get their result back and it's a negative test and they have no symptoms, they may return to work the next day. And the policy, the national regulation has changed. No retesting is required for someone who is sick or who was positive to return to work because they're no longer infectious after a specific period of time. Excuse me. Businesses are also encouraged to implement staggered or shift working and to divide teams into smaller units so that if someone is infected, their pool of close contacts is as small as possible. Otherwise, your business might have to close down because you don't have big enough workforce and then reopen when everyone's able to return to work. In terms of non-compliance around managing workplace safety, the first is very much is around an infected person being in the workplace. That can occur either because the person is infected but they're asymptomatic, so they do not know that they're sick, or it can be that there's inadequate regular employee screening at your business, or due to the employees not staying home, and often this is due to a fear of losing wages or their job, or not realizing the implications of them being at work, not realizing quite how contagious they might be. The second area of non-compliance is inadequate management of a sick person in the workplace. So, for example, not isolating that person or not enabling them to be sent home safely. Next is inadequate cleaning following an infected person being in the workplace. So we've had numerous reports of someone testing positive, being sent home, and business carries on as usual. So that deep cleaning is really required. And then lastly is exposure to infected customers. And this might be where your customers aren't wearing masks, etc. And there you need to overcome that through enforcing mask wearing, putting up posters as far as possible, making sure you've got sanitizing stations available, and asking customers not to enter a business if they are sick. This slide just provides a number of resources, and this repeats what Robert has already shown. But we do have resources around more detailed guidelines, FAQs, an employee FAQ to help employees also understand what's required of their employer, but also to help understand what they're responsible for. There's a lot of communication material available, so the links are provided there. And we do have support, so please reach out if you need any further support, if you need any technical assistance. If as a business you're looking as to where you can buy personal protective equipment, you can visit the marketplace that's been set up on the COVID website. And if you're a business who wants to supply PPE goods or services, please register your goods or services on that website as well. This slide has, first of all, where you report positive cases. So if you have positive cases in the workplace, legally you're required to report to the National Department of Health and National Department of Labour. We also ask that you report into the provincial hotline. So there's a reporting tool there so you don't have to sit on the phone for a long time. It's a fairly simple reporting tool, but it enables us as a provincial government to be aware of where infections are taking place, where potential hotspots are developing, and importantly, where businesses might require support so that we can offer that support. And then lastly, we do have a non-compliance reporting channel as well. So this is for customers, members of the public, and employees and others to report non-compliance. Where cases are serious, they go directly to the Department of Labour. But for most of these cases, we engage with the business and we try to help the business kind of find their way through what it is that they need to do and to put in place, because we recognize that this is a very new area for most businesses. So thank you very much. Thanks, Robert.
Okay, thank you very much, Helen. That was really a great overview and insight into this field. So it's a lot, and I can just imagine as the audience is sitting out there, it's a lot to take in. I've got a couple of questions, and there may be some more questions that come through in the chat room also. So firstly, perhaps to start, because there's such a lot of information, I think organizations and businesses may already feel quite overwhelmed with one, going back to the workplace, reopening the businesses, getting everything started again. But in your experience, where for maybe businesses, organizations that are just kind of starting under especially lockdown level 3, what would you think, are the key 3 or 4 things to start off with? So just because I assume this is something that you ideally would like to have implemented as soon as possible, but in terms of practicalities and what business owners and managers are able to do, in your experience, what would be the critical few things that businesses should start with? So that's the first question. And a second question is that as I've been listening and looking through what you've been presenting, a large part of it actually comes down to behavioral change, which I think is someone that no regulation or rules or guidelines could actually enforce. And maybe have there been some examples in this very short time of 2-3 months that we've been faced with this, been examples of best practice or good examples of behavioral change? If not, that's fine. But I think that factor may be a big one, considering what's lying ahead. So maybe any feedback from yourself on those two questions for now?
Yeah, thanks very much, Robert. And fully acknowledge this is daunting. It's occupational health and safety on steroids. And for many businesses, they haven't had to engage in this space before. I would say the absolute first thing is to look at your vulnerable employees. So really understand who's potentially vulnerable and what can you as a business do to protect that person. The second key thing is education and awareness raising for all your employees, because the more, and it's developing your protocols and developing your communication material with your employees. So rather than just doing it and handing it over, it's really developing it with them, helping everyone understand the role that they need to play, because it links to behavior change. And we're finding behavior change is the key area where some of the glue becomes undone, or some of the best laid plans become undone. So I think bring your employees along with that journey, and then really look at how your workplace might need to operate differently. Spatially, but also time-wise, where you can separate our teams, focus teams working differently in different areas. I'd say those are three of the most important things. And then just the fourth one is really you need to have a very clear protocol in place for how you manage things if someone becomes sick. So what we've often seen is it's only when someone becomes sick that a business suddenly realizes they have no clue what to do. And we then get panicked phone calls. So yeah, I'd say those are kind of the top of list things to do. You can build on things, there's perfection, etc., but there is a lot to do. In terms of behavior change, yeah, so some examples of good practice have been, behavior change is tough and it takes a long time for something to become a habit. One thing that's worked well in some businesses is having kind of a COVID champion per team. But importantly, rather than that champion being a manager or always a manager, is rotating that role. So you have a group of 6 people that work together, and it's rotating that they each have a week where they're kind of on duty. They're working closely with their associates. They're not going to want to give their colleagues, they're going to want to make things work, because soon it's going to be their turn to be the COVID champion. So that's a good example. In terms of awareness raising and encouraging behavior change around how the virus spreads, some very good videos have been shown in terms of the use of glitter, around showing someone who has glitter on their hands and they walk through a business and literally do a few things in the course of half an hour in a business, and showing how that virus has potentially effectively spread. So that really gets people's minds thinking. On behavior change, there's always that tension between, do you go the carrot or the stick? Do you threaten or do you incentivize? And it is, unfortunately, it's a mixture of both, also because different people respond to different stimuli. But yeah, behavior change, we'll have to think of some more examples. But it's, one classic thing just to flag on is the home screening tool. It empowers an employee to manage things for themselves. They're not having to come to work for someone else to screen them, for them to then decide that they're sick and they should go home. It's about empowering that person so that they do implement that behavior. Thanks.
Okay. Then thank you, Helen. That's great. I think the case studies of behavioral change will probably come from unexpected sources also as we go through this process and people start sharing their stories. Of what works and also what doesn't work. And as you said a bit earlier, definitely changing a habit is something which is going to be very tough, and that is difficult under any normal circumstances in the first place. So maybe perhaps if we could move with a couple of questions more around the administrative aspects of this. So obviously there are regulations and guidelines and so on. And considering the audience on this webinar and also the audience that we mainly aim the webinar series to, are there certain minimum requirements in terms of risk assessment policies or documents? Because I'm assuming, and I may be incorrect, but that policies or regulations for businesses that have 3, 4, or 500 employees may be different to those who have 100 employees or 50 or even less than that. So perhaps what are the kind of strict things which businesses have to comply with in the SME sector? And then also, so with regard to that, does that get monitored or does that get checked upon? I'm not sure if from an occupational health and safety perspective, if there are certain things in place, or perhaps from the Department of Labor. So just from an administrative point of view, what would you say businesses or SMEs in this case have to be most cognizant of going forward?
Okay, so Robert, in terms of your first question, minimum requirements, the regulations differ depending on whether you're a business over 500 people. Mm-hmm. If you're over 500 people, the requirements around a formalized risk assessment changes substantially. But if you're a small business, and they define small in the regulations as under 10, it's slightly, I wouldn't call it relaxed, but slightly less onerous requirements that you can put in place. And I can certainly, I'll share the regulations document with you afterwards if you'd like to share that with everyone who's listening. And then what's critical, though, is essentially what's required by businesses is kind of the same. So in terms of an employer providing masks to their employees, that's a legal requirement. In terms of ensuring sanitization, social distancing, that's a legal requirement. So there are a lot of legal requirements on smaller businesses. Smaller businesses, might be less, there might be less inspections, etc., on smaller businesses, but it's just remembering that you want to keep your workforce safe and you want to keep your customers safe, and you want both to feel safe so that they feel comfortable to come to the workplace. So the more you can do and the more you can be public about what you're doing, the more you're kind of alleviating that fear. It links onto your second question, which is around monitoring of a business and workplace safety. So the Department of Labor does do inspections. They do proactive inspections. They sometimes warn a business upfront. The first thing they'll do is ask for their risk assessment or their workplace plan. If there isn't one, that becomes a flag to them. But they sometimes also do surprise visits. And if they get a non-compliance complaint, then they'll visit the business. To date, the Department of Labor has only had 25 inspectors for the Western Cape. As of Monday, they're going to have around 100. So you might not have seen a Department of Labor inspector at all in the recent past. Their numbers have, it's quadrupled. So they're going to be doing a lot more visits to businesses. But then importantly as well is through the non-compliance tool, that's a way of people reporting potential non-compliance. And that's a way of us being aware of which businesses might be complying or not, so that we can support them as best possible. Where it's blatant non-compliance, then as I said, Labour will move in. And if it's not rectified in a certain period of time, Labour has the power to close that business down. Thanks.
That's great, Helen. Then also perhaps with coming to the more, I think a lot of it is practical, but around actual things physically happening in the workplace, and maybe around the deep cleaning that is obviously, or deep cleansing, I suppose is the right word to use, that's been on the forefront of a lot of what's been said in the media and otherwise. Are there any guidelines or standards for what is considered to be a deep cleansing? Because I'm sure that's open to interpretation, because one person's deep cleansing process may not be the same, depending on who the manager or the owner of the business is. That may differ. And then I assume there's going to be a lot of private contractors entering the space as service providers who will be offering their services to do deep cleansing in the workplace. And I assume something that happens at the CTICC and the new Hospital of Hope there, those standards may be very different to what happens out in a light industrial area. So perhaps are there guidelines for what is considered as a deep cleansing process? And then also, I think many businesses may be asking the question that they're already under financial strain, and that there's already a lot of challenges from a financial point of view. So from what you know is happening in the regulatory environment from government and so on, and in terms of support to businesses, do you foresee that the costs of the operational costs in terms of PPE, in terms of deep cleansing and everything that goes together with that, is that something that businesses will have to absorb into their operational budgets, or do you foresee that there may be some kind of support or rebate coming from industry or other partners? Maybe your views on that. Thank you. Sorry, Helen, your sound is off.
There we go. Thanks very much.
There we go. Thank you.
So on the first issue, in terms of deep cleaning, mentioned briefly is you don't need to use a professional cleaning company, and you don't need to have what's called fogging or misting, where someone comes in and literally sprays the whole business. Some reports are even showing that could be dangerous to human health. You don't also require a formal cleaning certificate. If you experience problems with authorities that are requiring those, please reach out to us, and we'll engage and see where we can intervene. Cleaning, there are guidelines. So in the guidelines from Department of Health, they clarify what's required in terms of a solution. They even give kind of a homemade solution, disinfectant, which is, they're saying 30 milliliters of bleach per liter of water. So really trying to make things as low cost but as effective as possible. The guideline focuses on cleaning of areas and surfaces that the infected person or the sick person might have come into contact with. So it's certainly not a whole business unless that person literally went around and touched everything in the business. So if you've got someone who operates in a store or dispatch area, you want to carefully clean that area, but you also want to potentially clean the bathrooms and the canteen should they have used those areas. You need to ensure that whoever's doing the cleaning wears full protective equipment and that they wash their hands before and after the cleaning. And you also need to make sure that where an area can't be cleaned with soap and water, you look at using some kind of 70% alcohol solution. So it's looking at what's required and not going overboard there. In terms of the operational costs, unfortunately, yes, cleaning, managing things will entail an operational cost, and at the moment there isn't any government financial support around this that I'm aware of. That might not be the case, I'll find out, and it might be the case that support comes down the line, but at the moment there's no support on that side. Thanks.
Helen, thanks very much. And then just one last question, because we're going to start winding up in a minute. Just one last question, and then maybe over to you for last comments, perhaps anything you'd like to add. So the last question is with regard to leave, and I'm assuming employers as well as employees this would be something that comes up, because leave could differ. I mean, there are national regulations. Some people aren't employed on full-term contracts, so their leave conditions may be different to those who are contract workers or who are gig workers, as we call it that. But the quarantine or the isolation periods, one or the other, are usually for about 14 days as far as I know. And that, I suppose in general, that will be linked to sick leave, but it may also not be linked to sick leave. So I'm assuming a lot of that responsibility and discretion lies with the employer and employee and how they work it out, because I'm sure there's going to be cases where the normal leave is used up quite rapidly if employees or staff have to self-isolate or if they have to go into actual quarantine. Are there guidelines, to your knowledge, that could assist staff and employers to navigate that, or is it very much a discretionary issue that's left up to the business to solve themselves at this stage?
Yeah, so Robert, as per the regulations, people who are sick or tested positive are entitled to take paid sick leave. So that's in terms of Section 22 of the Basic Conditions of Employment Act. But if people don't have any more sick leave, that also poses a problem. And that's where the employer needs to make application for the illness benefit in terms of Clause 4. It's of the COVID Temporary Employer Relief Scheme, so known as TERS, to access funding, which they can then use to pay their employee. But what we really encourage, a lot of this is about negotiation and consultation between employer and employee. We would encourage where an employee needs to be at home but isn't sick or isn't sick enough and they can continue working in some form, to encourage that so you can reduce the need for them to take leave. You'll also find that as we enter the flu season now, and we're potentially going to go in cycles of people being sick or not sick, the issue of leave is absolutely critical. No doubt about it, people will run out of sick leave. So it's also, as an employer, just looking at what's applicable for your space. Do you have some form of work from home approach? Do you have special leave? Acknowledging that someone may be able to work part of the day but not the full day. And then if all else fails, looking at applying for funding through TERS.
Okay, excellent. Thank you, Helen. Wow, that's really been a power-packed session. Thank you very much. I'm going to just share one or two slides before we continue. Helen, I'm going to give you a chance for any last comments or thoughts you'd like to share. But just while you, before that, I'm going to just to our audience. Helen has provided a lot of information and a lot of guidelines. So I would just, if you're feeling that you're not sure how to access all of it, I'll just share my screen quickly. So as I said, this recording is being, this webinar is being recorded. But on the screen also there are some links to how you can find out how the Western Cape government is supporting businesses to implement safety measures. So perhaps you could take screenshots of these now, or we'll upload the video within a day or two, and you could come back to the recording to have a look at these and access these links again. So beyond this webinar, there is still a lot of information available which you can use as you navigate the space. And then secondly, another slide on information regarding preventing and managing workplace coronavirus infections, key links and contacts. That's also up on the screen now. So while I'll leave this up on the screen, perhaps before we close off and I wrap up, Helen, any last closing comments or thoughts or insights you'd like to share with the audience before we sign off, please? Thank you.
Sure, thanks, Robert. So I think the key thing for businesses is just get started. So you don't need to have a perfect plan. It's just really look at your business, focus on high risk areas, high risk employees, and try look at how you can make a plan for each of those components. So break things down into key chunks, minimize interaction between the different components of businesses and different employees. I think your employees are absolutely critical. So any protocol you develop, ideally develop in conjunction with your employees. And then also just transparency. So I would say a huge number of our non-compliance issues that are coming through is where an employee really isn't aware of what a business is doing. So they feel afraid, they feel that things are being done covertly, that information isn't being shared. So absolutely just engage your employees with whatever you do. People are scared. And really try alleviate that fear, try bring them along with you. And then lastly, just please reach out. Where you need help, where you're unsure, please reach out. We're here to help, and we'll do whatever we can to help you. Thanks very much.
Okay, thank you, Helen. That was really valuable and a lot of information and quite critical information for our business community at this time. So thank you very much to our panelist, Helen Davies, the Chief Director at the Department of Economic Development and Tourism, who's also our lead on the Slowing the Spread initiative and program of the department. So to our audience, ladies and gentlemen, that brings us to the close of our session today. But before we do the sign off, I just want to share a couple of a little bit more about our webinar series. So as I said, this is a weekly webinar series and which runs Wednesdays at 12:30 every week. We are still planning our July program, but for June, sorry, that slide skipped through. The next one, next week, Wednesday, will be on how to keep your business safe online. So that will focus on cybersecurity, data privacy, particularly focused on SMEs. We'll also go into e-commerce and online payments thereafter. And then on your screen, you can also see some links to our previous webinars. The link on the top, you'll see there, is where you can visit our website to view recordings of all our previous webinars. So that is something, when you do have time, it's also a very valuable resource that you could use. Also to our audience who has joined us, as I said, on this chilly Cape Town day. It's really good to know that all of you have been out there and that you could join us. I hope you found some value in the information that was shared with you today. It's going to be a difficult time for all of us to navigate. We as the Western Cape government are trying to do our best to support the business community, but as you heard, a lot also relies on you as business owners, as managers, as leaders, and then also staff, because ultimately it's really about protecting everybody's safety, the safety of our families, our friends, and ourselves. So on that note, I wish to thank you again, our audience. I wish to thank our panelists, also to the digital economy team in the back of all of this that helps to make this happen. Thank you very much. And so the wish is for you to stay warm, stay healthy, stay safe, and we hope to see you again on our next webinar. Thank you and goodbye, everybody.